Well, zero never looked so good. On Tuesday of this week, the Thunder Bay District Health Unit announced it had no new cases of COVID-19 to report. The unit hasn't been able to say that since last November, but it wasn't a lasting trend. 8 new cases were confirmed yesterday. Overall, our active case count is hovering around 30, with the daily case announcements remaining in the single digits. And as the number of cases in the district is dropping, so too is the number of vaccines being administered. Now, to find out more, we've reached Dr. Janet DeMille. She's the medical officer of health for the Thunder Bay District Health Unit. Good morning.
Good morning, Mary Jane.
So what was the mood like on Tuesday, being able to say 0 new cases?
You know what? When I came in the morning into work and I just saw that, and it was like, wow, it was awesome, really. It was sort of, 0 never looked so good.
Exactly.
Yeah.
So how are you feeling about the continued downward trend?
You know what? I'm increasingly optimistic that we have really avoided, something here, like a surge, or we've the last couple of weeks being able to hold our numbers fairly low and being able to really increase our numbers of people vaccinated. All of this is really going in the right direction, and it just has me increasingly confident that we've avoided something more significant happening to us here in the spring. And not that we're out of the woods. I still have a lot of concerns, but in terms of that sort of broader community spread, I think whatever we're doing, we just have to keep doing.
And how do our numbers relate, would you say, to the rest of the province?
So we are, I think, in one of the best situations in health units. So there's 34 health units across the province, and I think we're, probably in the bottom 5 in terms of the number of cases and our incident rate right now, and kind of hovering around there. Now, if we had an outbreak or something that would even in one location or associated whatever to a social gathering or something that would put us up again, but I think we're doing well, and it's uncomfortable to see what's still happening in other health units, including Northern health units, and including Northwestern Health Unit and some of the things that they've seen recently. That just keeps we're still at risk, and we all have to keep doing the right thing, but we are getting better for sure.
Now, I remember in the past you saying that sometimes you can look at what was happening in, Toronto or the higher populated areas and kind of see that trend in terms of how we would kind of follow suit. Are you thinking that's not the case anymore? Well,
I think we're always at risk based on what's happening in other parts of the province, just because of the interconnectivity, and we even know that we're influenced by what happens outside of Ontario and other parts of the country, even because we do have essential workers that come in here, for example, from various areas. But certainly there is still ongoing connectivity with the GTA as one of our biggest the areas that can influence us. And we've always seen a bit of a delay. So when we first saw over a year ago when we first saw COVID in the province. Of course, it happened in the Toronto area first, and then, we were impacted several weeks later. We saw that in the second wave when we all kind of entered, the fall and winter season, where it's sort of respiratory virus season. We know these things circulate at that time. We were delayed compared to the rest of the province. But I think at this time, we're not necessarily going to follow what what's happened in Toronto. I think maybe we've largely avoided that here at this time. And we're getting into the spring and summer season, of course, where this virus there's a lot of things that are going to be working against this virus. And not only that, our high immunization rates right now are going to protect us as a community.
Now, we're hearing the stay-at-home order is likely to be extended to June the 2nd. Is there any discussion on a regional approach before that?
So I haven't heard that much about the reopening and what the plans are, to be honest. And I mean, it does come up, and I'm really hoping that they're looking at the framework. And as far as I really do believe that they're looking at a regional reopening. I don't know what that will actually look like and what will that mean for us, because obviously I would anticipate that we would be one of the first health units that would be, allowed to sort of reopen. And I don't have much information about what that actually looks like. Is it the old framework? Is it an updated version of that framework, that color-coded framework? I would also like to see the province take advantage of opportunities in the fact that it is the summer and that outdoors is safer than indoors. And, if we are allowed to do things more than we currently are, it would be certainly nice if they allowed sort of some of those outdoor, promoted more of what we could do outdoors.
Mm-hmm, mm-hmm. Now, let's talk about vaccines. You mentioned our immunizations rising. The number of doses, though, being administered has fallen from around 8,000 or more in April to about 5,700 last week. Why is that number decreasing?
Well, it has always gone a little bit up and down, and a lot of it is dependent on our supply and, the supply of the different vaccines that we get. And we did have, some really good weeks, and we're going to get back there and fairly shortly. I think this week is going to be much higher than it was last week. And also, it was really the last couple of weeks our supply was considerably lower. And part of that had to do with the government strategy around the hotspots areas in Ontario. So they actually took some of the vaccines from non-hotspots areas and reallocated them to like the Toronto and Peel region as two examples are those particular postal code areas. And actually the evidence that was presented yesterday by the province showed that worked, that those hotspot areas have caught up to non-hotspot areas and have actually exceeded that, and that the non-hotspot areas like we are, there was a bit of a slowing of the increase in percent immunized, but that was just the first 2 weeks. So this is the second of the 2 weeks that we were lower in the number of vaccine we were getting, and we are getting more next week.
So more types of workers, age groups becoming eligible for a vaccine, but there's still a fair bit of confusion. For instance, some people have jobs that brings them in contact with the public, but they're not considered essential workers. Some people with chronic or serious illness don't fall into an eligibility group. Any words of advice or guidance for people trying to navigate?
Yeah, I realize it's tricky, and we have to deal with these questions all the time. And if you go to the government's the plan that they have, the Ontario COVID-19 vaccination plan, and look at phase 2, there's a lot of details there about who qualifies and who qualifies when. So you mentioned at-risk, the health conditions. Well, there was a very clearly defined list of those at highest risk and those at very high risk, and those individuals have been eligible for immunization. That was here in Thunder Bay, done through the Thunder Bay Regional Health Sciences Centre Mass Immunization Clinic. The at-risk category, though, was not eligible until this week, and sometimes it's sometimes a very narrow distinction between those who are at high risk and those who are at risk, and that was, I think, a bit problematic to kind of communicate, and did cause confusion, and for healthcare providers as well, and it but now those individuals are now eligible to get an appointment. And the essential workers are the same way. So there's essential workers who cannot work from home, and they're divided into Group 1 and Group 2. And it is easy to find other essential workers who might qualify, might seem like they have some sort of level of equivalency that aren't actually listed on the list. And that's, I do realize that's a bit challenging. But if you go, and it's on our website as well, we try to provide this information. But again, I'm really glad to see, though, that all of those essential workers on List 1, Group 1 and Group 2 now qualify for immunization. The Group 2 qualified as of this Tuesday. And I think today is the day that we go to 40 plus. Anybody over the age of 40 actually will be eligible to have an immunization or book an appointment. And next week it's going to go to 30. So I think what we're going to see over the next couple of weeks and by the end of the month is really everybody who's eligible. Everybody everybody will be eligible for a vaccine, and the nuances of different people's situation won't matter.
Well, and you know, like you say, part of it is age at this point. Part of it is job. I mean, there's the example of a lot of workers in grocery stores, for example, that aren't even 18, so they are wondering what to do.
Yeah, so I would just hold on for those, because I think what we're going to hear, and hopefully fairly soon, is direction on 12 to 17-year-olds. And I think the challenge is they're essential workers when they're 16 and 17, but the only vaccine that can be used is Pfizer, and what we're using now is a combination of Pfizer and Moderna, and we tend to, like, and most of our clinics tend to just have one of those types of vaccines. So if it's Moderna, then a 16 and 17-year-old would not be able to be immunized, and we have the provincial system doesn't have the that sort of division between to kind of make sure that 16 and 17-year-olds can only go to the Pfizer ones. But I think we are going to hear, because now Pfizer is approved for 12 to 15-year-olds, we will be hearing more information, I suspect. I'm really hoping within the next week about that group and when their official eligibility will kick in.
And I mean, many people still looking to get that first dose, but what have you heard in terms of speeding up the time to get that second dose? So in less time than the current 4 months?
So again, this is probably something we're going to hear a lot more about, especially as we get into June and throughout June. It's really important to still be very focused on first doses, because that gives us a level of community immunity and it protects the most number of people. But we do know that there are individuals who are now even eligible for a second dose and getting it earlier than the 16-week time frame, and that includes individuals who have certain underlying health conditions. Anybody in a long-term care facility. And we do know that very shortly, I think it's actually tomorrow is the official, highest risk healthcare workers will be eligible for their second dose. And then as we move through, I think as we have less first doses to do and we get into having more supply and more second doses naturally coming up, there will be, I would anticipate, likely quicker ways for people to get or earlier ways for people to get their second dose, and there'll be more information. I will also note, actually, that there's going to be a significant expansion to pharmacies and to primary care. That I think pharmacies, we've already started with primary care, but pharmacies, by the end of May, we should have more vaccine in pharmacies, and that will include the Pfizer and the Moderna. I'm not sure which, or if it's going to be both. And as supply increases, people will have I would imagine people will have different places that they can go for that second dose.
Once again, I appreciate you giving us all the information you can. We always have a lot of questions for you, and I appreciate you coming in.
Well, I appreciate being here, Mary Jean. Thank you.
Okay. Dr. Janet DeMille, the Medical Officer of Health for the Thunder Bay District Health Unit. Of course, when I say coming in, I mean into our program. We are still physically distancing here at CBC.